Hello, everyone. It gives me immense pleasure to welcome Dr. Anoushka, who has secured a superb rank 4 in the AML AIMS merit list of the Pediatric Neurology exam. And we know how competitive pediatric neurology is, like especially among the organ system based, or we can say like the non-neonate, non-critical care branches of pediatrics. This is easily the most competitive exam. I see most of the students vying for this peds neuro, whether it be via NSS, whether it be via NEET SS. And for you to take the decision firstly of choosing peds neuro and then acing the exam, hearty congratulations to you, Anushka. So firstly, how are you feeling after this result?
Um, so it was a, I mean, the
Still
exam is
sinking
done.
in.
Yes, it's
Yeah,
thinking in. So,
great. And like for our viewers, let's have your introduction firstly, and also how your academic journey has panned out.
um, so I've done my undergraduation, post graduation from UCMS, Delhi, and then after completing MD, I joined there as a senior resident. Um, I was in the pediatric emergencies and the oncology, hemat-oncology wards. So I had no experience in hemat-onco in during my PG. So I tried to get some of that as well during my senior residency because after completing my MD, I was very clueless about. I really wanted to do. I wanted to study further, but I was not sure which direction I wanted to take because I love all of it actually. So I gave myself some time, and I started from. I knew that I wanted either um, neuro or oncology or hemat-oncology or critical care. So I took the following months to narrow it down to one thing, and as I was working, I gradually realized that all the only drawbacks that I felt neurology had were there in every other field as well. So I just felt that the cases in neurology are the most challenging, and I wanted to get that confidence in managing them properly. And so um, I I think around um, a few weeks, 1 month before uh, the initial NEET SS date, I had done along with work. I mean, it's a little difficult to prepare for INISS along with work. So 1 month before INISS, I decided to um, take some time to fully dedicate it to studying for the exam. So I uh, left my senior residency 1 month before the exam, and then I was um, because there are very volatile topics in neurology which are very tough to remember, and a lot of everybody used to say. Everybody used to tell me that neurology is extremely challenging and the exam is very competitive. So you have to try to give it your best shot. So I realized that I'm not able to remember things directly done from the book. So I made some notes. I made two sets of notes. I made one set of notes for neurology, one set of notes for neuromuscular. So I had one notebook for each, and for the more volatile topics, I for example, neurometabolic diseases. I used to what I did was that I used to take like A3 size or like bigger size papers and make certain flow charts, which would help me remember those topics. So that I was not able to do that with work, so then I took some time to prepare properly for that exam.
Great, you like covered a lot of things in your answer. So you showed us how you have to take the decision firstly, because especially in
Yeah.
pediatrics, it's always a decision whether to do DM or not firstly, and then to
Mhm.
choose the subject of choice as well. Then you also told us that you have to navigate through working as well as preparing, and you took a break, and that helped you a lot. And then you told us about certain methods of studying, especially with creating something like a mind map in a big page about a particular topic and breaking it down so that it helps you in revision. Like anything else, especially through the INISS, because we know page neuro is something that is in a way very vast. If you want to go into it, you can keep going on. So how did you navigate through that prep, and how did test yourself through all of this?
So I think we've been studying since we were 15, 14 years old. So we have certain, after reaching this level, we all of us have curated certain tricks which help us focus and which help us memorize things. So I think I just consolidated all of those tricks and I tried to employ them as much as possible. Um, so I used to regularly do neurology specific tests, as well as I did doctoral GTs, because the general section is also can also be very very scoring.
Carries
and
weightage as well.
and the marks, if you see the marks in all the previous results, there is not much difference in the top few ranks. So I
Hmm.
used to so I used to give 2 days to neuro, then 1 day to a general topic, then 2 days to neuro, then 1 day. And there was not so much time, but I tried to divide my time accordingly. And so I try to finish my notes so that I get enough time to revise those notes. And I made I scribbled down tables, because there are a lot of tables in neurology, and you have to remember genes, you have to remember tables, you have to remember um, multiple such things. So for those topics, I used to make. I know that mind maps have, like, these charts have always helped me since first year of undergraduation. So I continued making them. And for general topics, I had made for some units. I had made notes during PG, but they had lacunae, so I had to fill those lacunae as well. And I had finished some topics when I was preparing for the first NEET, and the I also gave the previous NEET SS, which was immediately after I had completed my MD in February this year. So just a month later, there was the first NEET.
Yeah, there was a
So
need.
I
Yeah, yeah.
so after my MD finals, I studied as much as I could for that NEET. At least finish like some units, just the important topics. I was able to make notes for them. Then I gave the next INISS. I was never able to prepare fully well for any of those exams because I was working along with the exams. So, but I tried to find the lacunae in my existing notes and fill those lacunae. Then, so I was able to use these notes to prepare for the general section of INISS. And also, for the especially for the general topics and the most important topics, I used Doctor Elite test series and the mini tests, the question banks. Uh, I think they really helped me prepare for those topics.
I think you were really planned. Like even the 2:1 ratio, which you're telling that you use 2 days for neuro and 2 day 1 day for general, that exactly mirrors the exam. Because even in the exam, if we look at things, it's approximately 2:1, right? Like
Approximately.
something like 50 of the peds neuro and 25 of approximately. So
Huh.
very well planned. And also like you told us about this kind of switch or shift that was happening between the INISS prep and NEET SS prep, which is always a challenge, because even it will be the same next year as well. Either it will be NEET SS followed by INISS, or the other way around. So how do you think students should prepare? Like, do they have to kind of choose one exam, or you know kind of try to navigate both things at once? Like, what would you advise your juniors with respect to that?
So immediately after MD, I I think I used the first NEET and the first INISS um, to prepare my strategy. I think I just gave those exams to understand how I want to approach the exam that I give fully prepared. So also studying for NEET SS helps you realize how much you like the subject that you're um, going towards. So when I was doing my NEET SS preparation, I was brushing up on topics from every unit, and I realized that I just really like going into the depths of the topics from neurology and neuromuscular, and I already
Neurology.
had that interest developing inside since the beginning of PG. But it is a tough decision to take. It was, I mean, it's not for everybody, and for me it was a difficult decision. But once I had worked in hemato-oncology as well, and emergencies also help you realize the cases that uh, make you the most interested. So it took me a good enough time to decide and plan how I want to what I want to do. And once you make that decision, I think then it is so much easier to prepare for the exam. So once I was sure about my decision to take up neurology, I was able to give it all of my
You're
focus. And so initially, I think some people are clear about what they want to do from the start. So if they are able to take that decision in PG as well, so they can start. I think they can start just making notes of the volatile topics initially, and revision is, especially in neurology, I think you have to revise many times because it is difficult to remember everything.
And what about the interview? Because that is a part in most, or if not all, subspecialties. There is the interview wherever there are seats in names, right? So how did you prepare for that?
So I had given the interview in when I gave the first INISS. So that helped me realize, helped me prepare an approach because I knew that there is a departmental assessment and the questions can be from any topic. And initially they have an interview specific to the unit that you've given that you've appeared for. So I also um, uh, try to speak to people uh, who had given the neurology interview before, and also there were videos on YouTube. I watched videos of people who had given the interview. So I realized that you they will show you a case and they will test your approach. So I revised every topic in neuro, and along with that I read up cases or um, went back to my practical notes, um, my the practical books that we have. So I revised them. I tried to make it was not possible for every topic, but I tried to make certain approach flowcharts as many as I could for movement
Yeah.
disorders, neuromuscular, for neuroradiology. Um, suppose if they show a CT or an MRI, so if I can how I should answer, what I should start with, and they in when I gave the departmental assessment, so they first showed it was a movement disorder. Um, so I tried. They had questions, and it is like an OSCE, so you have to answer it according to that. So I um, gradually narrowed down to my final DBs, and and then we have the departmental assessment for which I had brushed up on all cases from other units which are related to neurology. So, and biostatistics. So, biostats is um, something that I had prepared for. Um, so I had my NEET PG notes and my notes when I which I did use before BCBR before for my thesis, and I had a consolidated set of notes for biostatistics which I have been revising uh, since undergraduate days. So
Since, yeah, since UG.
I used them to prepare, and there were a few questions. I think there were there were 2 3 questions in our MCQ paper as well, and there was one question in the development assessment. So biostats can, I think, be important.
Great. Like you were very strong with respect to understanding what to prepare, and then you executed it as well. Like biostats is one thing that students sometimes forget to prepare, because obviously it is something that we don't consider it as a core part of preparation. But yeah, so like we have videos by Rajasri ma'am, and also even better if somebody has a consolidated notes which you have read right from your UG, like what better than that, right? Because even today as we speak, when the NEET test has happened, a lot of I think 5 to 10 questions of biostats were there, and that came as a surprise. Yes, obviously that's a large number, but still we should read biostatistics and go for any exam, especially at the SS level. And finally, like Anushka, after this result, like what about a vote of thanks to whomever you would like to thank? Of course, your family and everything.
No, so my family, I have been focusing on the exam almost. The PG, if you don't really, uh, 3 years of PG go by caught up in work, and immediately after PG, I started preparing for the exam. Um, I mean, along with work initially. Um, uh, so my parents and my entire family has been very, very, very supportive, and it's also initially when you're confused and clueless, um, my family is always there to help me just listen to my confusion. Um, so so grateful to them, and also to also you, um, and Aditya sir and ma'am, always thank you for being so active on the WhatsApp group. It is very um, it also offers a lot of moral support to know that someone is available. Even late at night, I have seen all of you answer our questions on the WhatsApp group at odd hours. So thank you so much for that.
Yeah, we try, like when I think through these last 6 months, the number of students and the number of doubts have increased so much that we at least try to get back within 24 hours or so. But yeah, like
No, this
that was thank you so much, and it was great talking to you. And I hope you do great through the field of peds neurology. And as I speak, I know that I can see the love that you have for your branch, pediatrics and or neurology, and I know that you'll do really, really well. All
thank
the
you.
best. Really nice talking to you. Bye.
Thank you so much.